So today I'm going to be doing the wet to damp dressing procedure check off. So before I go in my patient's room, I'm going to check the physician's orders and make sure that I check infection control guidelines for the facility that I'm at. And I'm going to go ahead and perform hand hygiene. And I'm going to make sure that I'm using the right patient identifiers, which is name and date of birth, when I go in and talk to the patient. And before I go in, I have already assessed for her pain level, and I medicated her about 30 minutes ago. So now I'm going to go in my patient's room.
Come in.
Hi, Miss Kelly. My name is Emily. I'm going to be your nurse for today. I need to come in and do some wound care, so if you'll be okay with that, I'll be in here for about 30 to 45 minutes. Is that okay?
Yes.
Okay, great. And can you tell me your first name, last name, and date of birth?
Jalen Kelly, 9/25/96.
Okay, and do you have any allergies, latex, tape, antiseptics, any type of medication?
No.
Okay, great. So now I'm just going to gather my supplies together. So I'm going to need some 4x4 gauze and a dressing change tray with some saline, and then some saline syringes, some gloves, and here is my wound. So Miss Kelly, are you experiencing any more pain?
No.
Okay, great. So now I'm just gonna lift the head of the bed up and lift the bed up for my comfort and safety and for her comfort and safety. And now I'm just going to make sure that the client is in a comfortable position, whether that's lying or sitting, depending on where her wound is. Okay, so now I'm just going to place my biohazard bag in a reachable area, and I'm gonna go ahead and perform hand hygiene and put on some clean gloves. And we're gonna take this old dressing off. Okay. So now I'm just going to loosen the edges of the tape with my fingers, and I'm gonna go ahead and make sure that I'm pulling the skin in the opposite direction that I'm pulling. And if her dressing was sticking to her skin very bad, I would get some saline and moisten the tape to take it off. So I'm going to make sure and lift the dressing from the corner toward her wound, like this, and make sure that we, oh my goodness, this is so sticky. And while I'm taking it off, I'm gonna go ahead and put that in the biohazard. While I'm taking it off, I'm looking for any type of drainage, the color of the wound, and just to make sure that everything looks okay. If it had any drainage, I would note how much it was, the color, the odor, consistency, or anything like that. So now I'm going to take off these gloves and dispose of them in this biohazard bag. And I'm just gonna look at the wound. I'm gonna get a culture if it was ordered, stage it, look at the size, the length, width, depth, all of that. If it had any tunneling, and check for any pain, look at the edges, look at the actual site and the surrounding skin and see if there's any other kind of infection or anything like that. And now I'm gonna go ahead and put a new dressing on and clean it. So I'm gonna perform hand hygiene. So now I'm just gonna open up my sterile dressing change kit. So I'm just gonna open it away from me and grab out my sterile drape. And we're just gonna make sure that we're only touching an inch from the top. And I'm just gonna place it onto the table. And we're gonna make sure to stay at an inch at the borders and not reach over. And then I'm gonna take out my sterile gloves and put them onto the sterile field. So my sterile gloves are on the sterile field. Now I'm just gonna dump out everything that's inside of the kit and put this tray here. I'm gonna go ahead and put some saline into the tray for cleaning. And make sure that I'm opening this. Don't touch the rim of it. Dispose of that. And then we're just gonna pour in the saline and dispose of that. And then I'm going to put on my sterile gloves. So I'm gonna make sure and use my dominant hand to put on the non-dominant glove first, only touching the lower tab. And then I'm gonna tuck my two fingers of my non-dominant hand under and put on my right-handed glove, and only touching the sterile part. And now I can adjust on this hand. So if I had forceps, I would use those to put the gauze inside of the kit with the saline, but we don't have forceps, so I'm just gonna use my fingers. So I'm gonna grab 1, 2, 3, 4, 5, that should be enough. And I'm just gonna reposition all of my supplies. So now I'm going to make sure and moisten all of these pieces of gauze, and I'm going to wring out any excess fluid or anything like that, and we're gonna go ahead and clean the wound. So I'm gonna clean the outside of the wound first, from top to bottom, making sure that I'm going from clean to dirty, and dispose of each piece of gauze as I'm going with each pass. So from top to bottom. And we'll just clean it one more time real good. And like I said, I'm wringing out any excess fluid or anything like that that I have from top to bottom. Okay, so since I haven't broken sterile field, I'm gonna leave on the same gloves to reapply a dressing, and just make sure that I know that my sterile field is anything that's above waist level. Anything below the waist is not sterile, and my sterile field is always in the field of vision. So now I have got my gauze inside of the container with the saline, and all of this is still sterile. So I'm going to get one of the pieces of gauze and pack the wound. So I'm going to go ahead and wring it out, and we're just going to fold it once. And to pack the wound, I would be using either the forceps or some cotton swabs, but we don't have those available to us in our kit. And just make sure that I'm going in all of the crevices, any of the depressions of the wound. If it had some tunneling, just make sure that I'm doing that as well. And then I'm going to apply the secondary moist layer above this, just like that. And then I'm going to grab the ABD pad, and I'm going to leave it folded just because the wound is kind of small. We're just going to sit it right on top. And then I'm going to grab some tape, and we're just going to tape this dressing down. Like that. We'll make sure to do one on the end so that it doesn't pull on anything. Miss Kelly, are you having any pain?
No.
Okay. Make sure that the dressing is secure, like that. How does that dressing feel, Miss Kelly?
Great.
Okay, I'm just gonna dispose of my tape, and I'm gonna go ahead and dispose of my gloves into the biohazard and perform hand hygiene. And now I'm just gonna go ahead and get rid of all of my supplies. So the sharps container is where the scissors or the forceps would go. So I'm gonna put these in the sharps container. And then I'm just going to gather the rest of my stuff and put it in the biohazard so that I can throw it all away. And while I'm doing this, I'm just checking around her room, making sure that her bed is in the low and locked position, and there's no cords where anyone can trip over them or anything like that. And before I leave the patient's room, I'm going to make sure and put the time, which is 11:55 a.m., and my initials EL, and the date, it's July 1st. And when I leave the patient's room, I'm going to go to the nurse's station and make sure that I chart everything, make sure that everything that I did is documented, and any kind of drainage or anything that I saw from the wound would also be documented.